parts of northern Gaza are already experiencing famine. That assessment from the Biden administration's top humanitarian aid official more than 6 months into Israeli strikes on Gaza. For more, let's turn to Dr. Margaret Harris from the World Health Organization. She joins us live from Geneva. Dr. Harris, Israel had agreed to open the Erez crossing to allow more aid to get into northern Gaza. Do you have any indication Israel has already done that?
As yet, we've not heard that crossing's open, but what certainly is needed is a flood of aid, and not just crossings open, but the means of bringing the aid to all the people wherever they are safely. As you've seen, that it's not safe for anybody, whether they be a mother, a child, or an aid worker. Anyone can be killed at any time. So we need the safety and the security in order to reach the thousands and millions who are starving.
Really bring me to my next question. UNICEF says one of its vehicles was hit by live ammunition while waiting to enter northern Gaza from the south. That, of course, on top of the Israeli strike that killed 7 aid workers working for World Central Kitchen. So you gotta wonder how this will impact the little aid that's getting into Gaza when aid workers, when aid convoys are not safe.
I tell you, Asieh, every day, and we have missions that go to the hospitals to provide supplies, to look at what's needed, to try to bring some food also to the health workers who are starving. They've all lost at least 30% of their body weight because they are working 24 hours and on very, very little food. And I read the reports with terror because they also stopped at checkpoints, kept there for hours. People are taken off the convoys, taken away. They don't know what happens to them. So every minute they are working, they are facing terrible uncertainty. A colleague of mine described arriving at Al-Shifa many months ago, before Al-Shifa was utterly destroyed, and a tank faced them and pointed its gun at the convoy. And my colleague said to his colleagues, "I'm sorry, I may have led you to my deaths." So every day is terrifying, but we and UNICEF and all the aid teams and international medical teams, we have 20 international medical teams, some from the US, some from the UK, who are now working in Gaza, putting their lives on the line because there are so many lives that need to be saved.
Dr. Harris, do you think those aid drops are effective? There's been a lot of criticism that there's not enough coordination behind these airdrops. And in fact, people are dying trying to reach the supplies that are being dropped from these airplanes.
Really, they're a symptom of the desperate situation. You will not reach or be able to target and provide the kind of thing everybody needs through airdrops. What's happening there is they are just trying to get some way of getting food in, because even to give you an example, even if a truck gets in, it has to be reloaded, loaded, checked, loaded, get to the warehouse, get through checkpoints. Delivering just a little bit of aid via trucks is getting more and more difficult. And Israel, as the occupying power, is actually responsible for feeding the population. So they should be facilitating this, not blocking it.
Oh, it sounds like they're not facilitating it, Dr. Harris. And let me finally move on to Rafah. What are your concerns? Israel says it has finally set a date for a military incursion for invading Rafah, despite pressure not to do so. What's going to happen with 1.5 million Palestinians have taken refuge in Rafah to escape bombing elsewhere? Where are they supposed to go?
There's nowhere for them to go. When the troops withdrew from Khan Yunis, people went back looking for their homes and found just piles of rubble. Rafah is the only place. So now most of the population is squeezed in there. And unlike any other conflict, civilians can't run to another country, can't get anywhere. They are just herded in this small space, and we've already seen an unprecedented level of killing. More than 13,000 children have been killed. And if the conflict goes to Rafah, we're going to see even more horrendous deaths.